वेलकम टू फोरेंसिक एक्सट्रैक्ट एंड आज हम बात करेंगे किस तरह से बॉडीज को प्रिजर्व किया जाता है. व्हाट आर द मेथड्स बाय विच ए ह्यूमन बॉडी इज प्रिजर्व्ड आफ्टर डेथ. So stay tuned for the full video. Please do subscribe Forensic Extract and press the bell.
Do you know Abraham Lincoln was embalmed after his assassination in 1865? His features were still recognizable even years after death. So what is the method? किस तरह से बॉडीज को प्रिजर्व करते हैं ताकि कई सालों तक, कई ईयर्स तक वो बॉडीज प्रिजर्व रहती हैं, सड़ती नहीं है, उनका डिकम्पोजिशन नहीं होता है. What is embalming? Embalming is the method or the art or science. This is the art or science of preserving human remains by treating them with chemicals to forestall decomposition. So the sole purpose of embalming is to forestall decomposition by using certain chemicals. Okay, so animal remains can be embalmed by similar methods. Okay, not only human beings but animals can be embalmed after death. Embalming preserves the body intact, whereas something is known as taxidermy. You must have heard about taxidermy. It is the recreation of an animal form, often using only the creature's skin mounted on an anatomical form. Now, the ancient culture that developed embalming to the greatest extent was in Egypt. Okay, the specialized priests were there in the Egypt. They were in charge of embalming. And what was the method they were using? They were removing the organs, okay, and the body moisture, and covering the body with natron. Natron is a solution of that contains sodium electrolytes. Okay, so in ancient Egyptian, it was believed that mummification, this preservation of dead body, enables the soul to return to the preserved corpus after death. Okay, this was the presumption. That's why they used to preserve the bodies in Egypt. Now, the first surgeon, Scottish surgeon named as William Hunter. He was the first surgeon, William Hunter. He applied the art of embalming. Okay, what was the case when Martin von Buchel on 14 January 1775, his wife Mary died. He had her embalmed body and kept her to draw more customers. Okay, Hunter injected the same Scottish surgeon William Hunter. He injected the body with preservatives and color additives that gave a glow to the corpse cheek, replaced her eye with glass eyes, and dressed her in fine lace dresses. Okay, the body was embedded in a layer of plaster of Paris in glass topped coffin. Okay, Buchel, the dentist, exhibited the body in the window of his home, and many Londoners come to see it. So it was the case done by a dentist with the help of the first embalmer, who was the Scottish surgeon William Hunter. Embalming, in which the chemicals are used to preserve the corpse. But there are other methods like deep freezing. Freezing can be helpful for preserving the body, but it is not for the longer duration of interval, not for years. First is the adipose reformation, in which the body converts into fat-like substance, and thus the basic structure, the architecture of the body is preserved. Okay, these are the phenomenon which seen in moist atmosphere. If the atmosphere is full of moisture, then the adipose reformation is very common. Second is known as mummification. This is also a modification of putrefaction, the mummification. Okay, this phenomenon is seen when the environment is dry. Okay, so this is due to desiccation, and in this modification also the basic anatomical structures are preserved. Thanatopraxia means it is the method of delaying or halting the decomposition. Okay, now the process of preserving the dead body by treating with antiseptic and preservatives to inhibit decomposition is known as embalming. Now what are the aims? To make the corpus suitable for public viewing. Okay, for basic anatomical dissection purpose, we need to preserve the basic structure of the body. to preserve the other purposes like for the religious purpose, for the sanitation concern, family preference, and for transportation purposes are the other aims of embalming. Now, the various steps of embalming are the first to wash the body with the disinfectant solution. Okay. Now, eyes must be closed with the glue. Okay, or maybe some artificial glass eye bowl can be inserted. Lower jaw is secured with wire or sewing. Okay, surgical process can be done, and the cosmetic procedures are the part of steps of embalming. Now, in this photograph, you can see that they have applied appropriate makeup. So this is the before photograph, this is the after photograph. So there is a huge difference. Wash and dress hairs so that the body will look beautiful. Choice clothing can be determined or decided by the family members. Okay, so now the loved one is ready to be kept in casket. Okay, several hours after the death. So now what is the embalming fluid? It is mainly 40% formalin. Okay, it contains formalin with glutaraldehyde around 1.5 liter. This is the main preservative. Okay, sodium citrate can be there, sodium chloride can be there, sodium borate, glycerin, 1% eosine, and water. This is to make the 10 liter, or depending on upon the weight of the body, the total solution, what is the amount of solution is required. So based on that, we'll add the remaining preservatives in that with water. Now this is the embalming machine. Okay, this is the machine which is having a pump, and this is the trocar part which has to be inserted into the vessels in different type of embalming, or into the cavity in other methods. So this is the basic embalming machine. Now what are the various surgical steps of embalming? Okay, body fluid, always remove the body fluid and replace by the formaldehyde based upon the chemical solution. Okay, we can add various other chemicals to preserve the dead body. Now the one is the arterial embalming. Okay, arterial embalming में क्या होता है? Blood removed from the body through the veins. वेन से ब्लड को रिमूव करा जाता है and replaced with chemicals. Okay, through the arteries. This is known as arterial embalming. There are methods of arterial embalming, in which one is known as 6-point method, in which we insert or inject the preservative through the both the carotids, or axillary or subclavian veins, and femoral veins. Okay, so these 6 vessels have been targeted or used for injecting the preservative, and one vein is used for withdrawing the fluid or the blood. Now the cavity embalming, something is known as cavity embalming, in which the small incision is created in the lower part of abdomen to insert the trocar. As you can see in the photograph, there is a small incision in which this trocar of the pump is inserted, and inject embalming fluid through this cavity or viscera, and will later on suture the incision. We will insert the embalming fluid through this pump into the chest cavity as well as the abdominal cavity to preserve the viscera. Something is known as hypodermic embalming, in which the injection of embalming fluid is used, needed, or in case to case it is treated where the arterial fluid or cavity fluid is not able to reach. Okay, at certain areas of the bodies where the preservatives cannot reach, where we'll use hypodermic needle to inject that preservative. This is known as hypodermic embalming. So this is a supplemental method for in addition to arterial or the cavity embalming. Now the surface embalming is used for applying preservative on the surface of the body, because fluid cannot reach up to the surface. So we will apply the various type of preservatives on the body surface. So these are the different methods of embalming. Now we are moving to the mechanism. Okay, what is the mechanism? By this process, by injecting the preservative, क्या होता है, टिश्यू फिक्स हो जाएंगे, ऑर्गन ब्लीच आउट हो जाएंगे और हार्ड हो जाते हैं ऑर्गन्स. ओके, एंड प्रोटीन गेट्स coagulated. The embalming fluid, the preservatives causing protein coagulation and halting the decomposition. Blood is converted into brown mass. Okay, and the embalming fluid injected immediately after death, it inhibits the putrefaction even for months. Okay, so embalming is the method used for preserving the dead bodies. Now, the embalming causes the chemical stiffening. Organs will be stiff because of protein coagulation, like in case of rigor mortis. After death, the body will be stiff. Or similar to that, this stiffening is known as chemical stiffening because this is happening because of the preservatives. Permanent embalming rigidity can be seen. Blood grouping is not possible. So that's why examination of body and preservation of all the evidences, all the samples should be done before proceeding with embalming. It is very difficult to detect for the poisons, so always preserve the samples before embalming. The rigor mortis is usually not seen in the embalmed body, so analyzing for the rigor mortis for determination of time since death should be done before embalming. Now, the disadvantage of embalming, it is basically difficult to interpret the disease or the injury. Okay, the alternation in the appearance of the body is obviously seen. Now, the detection of poison and drugs are very difficult because we have injected the preservatives in the body, so that's why it is very difficult to detect for preservatives. Embalming fluid can cause dislodgement of thrombus and emboli. That's why it is necessary to examine the body before proceeding with embalming. Now, the chemical used can be poisonous or harmful to environments. That's why it is suggestive to use only those chemicals which are not not harmful for the environment. Now, the embalming should always be done only after autopsy. This is the key, is that embalming or the preservation of procedure should be done after autopsy or collection of all the samples because it is very difficult to interpret the injuries, disease, and poisoning after doing embalming. It is the IPC 201 that is the causing disappearance of evidences that can be used against you if you have done autopsy after embalming because you have hampered or caused the disappearance of evidences because the preservative has been added into the body, so you cannot interpret the injuries or the disease or the pathology, and you have interfered with the chemical examinations.